Welcome to another episode of Project IMG Interviews. Our today's guest is the wonderful Dr. Flavia Cuestas, incoming pediatric resident. Welcome, Dr. Flavia. We are so glad to have you. And once again, congratulations. So, Dr. Flavia, we'd like you to start with a brief introduction about yourself and how you started your journey, your USMLE timeline, year of graduation. Just feel free to go about it as you wish.
Hi, nice to meet you. My name is Flavia Cuestas. I am a medical doctor from Peru. I graduated in 2018. My journey actually started in 2017. I decided that I wanted to be a resident in the United States that year because here in Peru, in order to graduate, you need to perform a sub-internship. I got a position in like the best hospital here in the capital of Peru. And when I was there, I realized that yes, there were amazing doctors. I learned a lot, but we didn't have like a strong academic curriculum in the hospital. And that's very important to me. I like studying, reading, doing presentations. So that was like my bigger motivation to receive the better education that I can. And then I start studying after my internship after I graduate, because the work in that in the hospital was a lot of work. You can imagine for sure. And well, my timeline was that I wanted to apply for match in around 3 years, but after the pandemic hit, I needed to change a little bit my timeline because I was already very close to take step one, but they, due to the pandemic, they closed all the prometic centers here in Peru. So there was no place to take the exam. Yes, that time was very hard because I need to keep studying like 6 more months, because after the 6 months, they reopened the airport. And that's when I was able to travel to the United States. So then I traveled to the United States. I took step one. Thanks God, I got a good score for applying to pediatrics. And then I stayed in the United States for 9 months. In that 9 months, I took the 3 tests, the step one, step two, clinical knowledge, and the OET. And I also performed 2 observerships because there was no way. Until now, the prometic in Peru is closed. So, yes.
So you had to travel to the US to take your step one as well.
Yes.
And also,
yes.
I'm sure with pandemic, so many students faced a similar situation to yours with regards to, of course, not only prometric, but also securing US clinical experience in any form.
Yes.
So the visa
yes, for
situation.
Sure. That's a struggle.
So how did you go about those challenges? Like, as you mentioned, pandemic really did like kind of delay your timeline a bit. So how did you overcome them? Some like, what did you do in terms of US clinical experience or visa?
Yes, so I performed the rotations, one in family medicine in Miami in a private clinic because the hospitals were not allowing, not even United States medical students. And then I performed an observatory of 2 months in pediatrics in Chicago. That was a private practice, but we also went to a hospital. So that was a good experience in pediatrics. I learned a lot about the system, also how to use electronic medical record. So I consider that performing an observatory of United States clinical experience is very important, not only for your CV, to apply, but because you need to know how are you going to work, how can you be more prepared to start residency there.
Right. So, I mean, right. That's wonderful. You also matched into pediatrics, right? So, and while it's one of the more like now these days, it's a popular primary care specialty for a lot of international medical graduates, but still internal medicine, because of course the rate of acceptance and the ease remains still popular. What was the thing that attracted you to pediatrics? especially over internal medicine?
Yes, so that was one question that I got asked pretty frequently in my interviews, actually, like why pediatrics? My reason is because I don't like working with adults. I just love kids and working with them. I have fun working with kids, playing with them. And it's, I mean, for me, it's amazing when you discharge a kid and they get to go home. They are so excited. It's like a party.
Yeah.
So for me, working with kids give me hope. It's a happy environment. So that's important for me.
A lot of joy. I've always felt joy
Yeah.
in the pediatric department of any hospital. It's a lot of
yeah. It's very colorful and happy. So yes, it's joyful.
Yeah, it's a lot of joy. You also have a lot of home country experience, like compared to other fresh like graduates who just get away straight into residency. Uh, as IMGs, we tend to have more home country clinical experience in general because we start our journeys late, and so do you. So you were preparing for your steps alongside your hospital rotations or your clinical practice. So how did you manage it? Was it difficult managing time, or do you recommend it given you don't stay out of touch of clinical practice? So what's your perspective on working along with preparation for steps?
Yes, for sure. I mean, it's very important that we keep up not only studying but work in our career with patients or doing research. Actually, you need to be very organized. I always plan my next day ahead because I need to do several things in the day. And I try to maybe change the perspective. When I was working, I think this is also important, like not seeing that the time you are working is a not well used time because you are not studying, because you need to accomplish both things, keep working and keep studying. And also when I work, that like relieve me because being having to study 10, 12 hours a day, sometimes it can be very stressful. So I took it like a distraction to keep working, talk with my patients.
That's wonderful. That's such a important thing because a lot of times people feel you need to focus just on the USMLE steps or the US clinical experience, and they ignore what is easily available to them, which is their home country clinical experience as well. So that's a wonderful perspective. How did you start finding your US clinical experience? Did you go through agencies or did you just network? How was it for you, and how many LORs did you manage to upload at the end of your?
Yeah. So I tried sending my papers to many hospitals, but the majority say that they were not allowing students or doctors. So I started networking. The pediatric observership that I did in Chicago, it was due to networking because some of my friends from my same university had already worked with that doctor. He's a Peruvian doctor in USA, so he was more than happy to help me. And the other rotation in Miami was also due to networking with some friends that are residents in Miami. So they already have some connections. So for sure, it's important to always keep talking, keep talking with your friends. Sometimes when we study, we just focusing, no, I need to study and just focus on the study, but talking with people and keep that connections is very important for your journey. Also, I wanted to do one more rotation, and I start searching on the internet, and I made a telerotation with a Dr. Watts in Chicago. It was a telerotation of 1 month. She's a pediatrician that works in emergency medicine. So I like that experience. She took the time to make us present like different clinical cases from our countries. We also have a simulation lab in the telerotation. So I would say that I learned. So with that one, I had 3 letters of recommendation from the United States. And my last letter of recommendation was from one of my university doctors, also pediatrician. So I work in the university as a professor. So they know me very well at my university, and it was a strong letter of recommendation. That's why they told me in the interviews.
Okay, so you also had a home country LOR. You also got an LOR from telerotation.
Yes, so they were 3 from United States.
Right. So, I mean, telerotation was another pandemic thing, like
Yes.
everyone was into minds about, okay, some were like, there were polarizing opinions about telerotation. Some were like, it's useless. Some were like, it's worth it when you have nothing. What was your telerotation experience like? Do you recommend it for someone who cannot get US clinical experience?
I think that in the case that you cannot get any United States experience, and maybe you try to networking but you don't find anything, that's better than none, because it's still in the telerotation. Maybe it depends on the doctor with you work also, but this doctor, she really took the time to teach us, to present our different patients, to do simulation lab, to teach how to work through electronic medical records. So I think that was our experience. I also meet good friends from different countries. And we create a WhatsApp group and we stay in touch about what things were they doing to complete their match application. So it was a good experience for me.
That's great. That's an amazing experience. You also have a lot of research experience, and research was, as you mentioned, you did a lot of research and it helped you, I mean, with a lot of connections, everything. So for primary care specialties, what do you think, how much of an importance does research have?
Yes.
Is it compulsory with the pass and fail step 1? Or, I mean, what's your opinion in general regarding research for primary care specialties like internal medicine and pediatrics?
Yes, for sure. I think it's important. I don't think that all of us need to do research, especially if you have, like, for example, graduated 3-4 years ago, maybe it's more important. Or maybe if you have lower scores than you wish to apply to your specialty, that can also be like a boost to your curriculum, because if you have just 1-2 years of graduation and you have great scores and good observerships, I don't think it's like that important, no? Also, it's a good experience. I perform research here in my country. I didn't do research in the United States, but I had 3 years of experience in research in basic science. And when I was in the interviews with the doctors, they seemed to like that experience. They asked me about what techniques did I learn, because I did like different techniques in the laboratory, and they like that. Also, some of the programs remark me that they do not perform basic science research. So if that was something very important for me, maybe that was not my program, So yes, for sure, they think that that's important.
Okay, so research it did make a difference to your CV, like the programs that you applied to were constantly asking you about your research. So
yes,
I'm sure. And also, I think the landscape will change the coming years due to the pass-fail of USMLE. Research might take a bit of a precedence over other things, because the scores for step 1 will be not there. So for sure. Dr. Flavia, you've been working as a professor, as you mentioned, in your university.
Yeah.
You were involved in research. You were preparing for steps.
Yeah.
You've done you've done everything alongside your journey, and we all know how grueling USMLE journey can be, especially for international graduates. How do you prevent burnout? Right, that's something which every USMLE aspirant goes through somehow.
Yes, for sure. Because I also have some burnout experience, because my step one test was scheduled like for March 15, and COVID hits like 1 week before that here in my country. So I was already ready to take the test, and they closed the Prometheus. So that was a very hard time for me, knowing that the airport was closed. I didn't know when the airport was going to open, how much time I need to keep up this time for step one. I was already tired. So I took like 2 weeks off to just rest, process all the situation, and relax a little bit. Then after those 2 weeks, I say, okay, I mean, maybe I don't like it, but this is happening. So I need to take advantage as much as I can of that time. So I got another job that was like a telework direction. I treated COVID-19 patients through calls, sending them ambulance. I also did a volunteer experience here in Peru, helping different kind of patients. And also I did 3 to 5 courses. I took the PULSE courses, the advanced cardiac resuscitation course, the basic life support course, one Stanford course to treat COVID-19 patients, one Cochrane course to get better with my research skills, keep up studying, keep up working as a professor. So I would say that actually that extra months that I need to keep studying for step one were well used, and that also reflects in my curriculum. So you just have to, when you need to relax, you need to take a time for yourself and then recharge and keep going, working the best you can.
Don't let the setbacks, get to you. I mean, and that's what you did. I mean, you didn't let it come in between your journey. You just kept on moving.
Yes.
Definitely how it should be. And also the burnout is inevitable at some point, but you need to just pause and relax.
Exactly. Actually, after that, after the burnout, it was like I was trying to study and nothing keeping my mind. It was not working my study time. So I actually, after that, learned that I needed to secure one day in the week in which I was not going to do anything, not study, not work, nothing, just sleep, rest, do whatever I want to do that day. So after that, always I have one free day. It doesn't matter anything, And that's a rule for me right now. I think that it's very important for your journey to respect yourself and put yourself also first, because if you are burnt out and you cannot study 1 month because you are feeling so bad, at the end you are not helping yourself.
Breaks and hobbies are a part of productivity. That's something I've learned from everyone's journey, including you. I think everyone who managed, whoever was working constantly, they had persistence to go through all the setbacks. Everyone said the same thing, that you need to take breaks.
Yes, and actually that's important. The programs want to know that. They want to know that you are able to handle the stress and all the things that for sure residency is going to be also a lot of work. So they ask you, how do you handle your stress? How do you protect yourself from getting burnt out? So it's very important. They also value that.
Absolutely, absolutely. So how was the whole match, the interview season for you? And how did you, I mean, one thing no one asks is what factors did you consider to rank the programs after the interviews?
Yes, so the interview season, I like it. The first 2 interviews, I was like more stressed because I didn't know how to expect, what questions were really going to be asked, or how the dynamics work. But after the third interview, I was like, it's okay, it's going to be all right, because I mean, the people that work in pediatrics, they are very kind, they are playful, they smile a lot. So the majority of the person that interviewed me were very nice. I enjoy the most of my interviews. with one exception, but it wasn't not even bad. It's just like I didn't fit in the program, and that's something that can happen. And also, I prepare for the interviews. I try to research all the most common questions to be asked, and I practice my answers like really with my friends that were also applying to match. We do Zoom video calls to practice to be more calm the day of the real interview, and that helped me out. And about the rank, you need to really stay true to yourself about which is the program that you like the most. For example, in my case, my husband also applied to maths. He got into internal medicine.
Wow,
So
congratulations to you both
thank
now.
you.
You're both
Yes,
PGY1 residents.
yes, we're very happy. But also, that was like I was at the start of my rank list. I was trying to like get in the same state that he had more interviews to be near to him, but then I say I cannot do that because that can really affect the result of your match. So I try to stay focused on what or which was the program that I like the most. Sometimes you also got confused. You start thinking, no, but I like more this city. Maybe no, I want to be in New York or Miami, whatever city you like. Or no, but this hospital gives me the most benefits and that can be more convenient. But really, the most important thing is where do you think that you fit the better and you are going to be able to perform better as a resident. Because if you feel comfortable with the faculty, with your co-workers, of course you are going to be a better resident. So I just rank in order the hospital that I really fit more in the interview to the least one. And actually I got in my number one program of my rank list. So I know that they are also very excited to have me. In the interview, I realized that they really consider me a lot. So I think it really worked out.
Wonderful, wonderful, wonderful. That's amazing to hear when someone matches with their first choice. It's just
Yes, it's incredible.
it's incredible.
And that program is very special for me since now. I mean, 1 hour after the match results were available on Friday 18, my program director called, my chief resident called me, all the doctors that interviewed me wrote me. So they are really special people for sure.
Yeah, that's amazing to start your journey with such a great energy.
Yes,
such positive energy. Yeah.
For sure.
So, Dr. Flavia, last thing on one last thing. If there's one thing that you'd like to say to all IMGs watching this interview, what would it be?
I will say that for sure, if you can dream it, you can do it. That's very important to me. If you have the dream to work in USA as a resident, you all can do it. It doesn't matter the struggles that you have. There is always a way. The other thing will be to protect your personal time, enjoy your hobbies, because that's also something that they value in the United States, that you have more to offer than only your scores and your work. You have to be a whole person. Stay true to yourself in the pathway, and also keep the networking up, have your Twitter, have your Instagram, use all the resources that you can, like this platform, like Project Immigrant, to keep on connecting with people, because you don't know where or when you are going to find a person that can be your mentor, that can really guide you. That will be my general advice. And of course, if you want to write me, if anyone is interested in pediatrics, you can write me. I will always help people out.
That's lovely. That's amazing. I think this is what we needed to hear. All the match candidates, including you, your journey, all of you have been so persistent with your journeys. Everyone has faced some or the other difficulties with regards to visa, USC, everything, and that's what makes this match so special. That things were different, but IMGs just plodded their way through and emerged victorious. In your case, you and your husband had a wonderful math season, and I'm sure your family
Yes.
must be super proud of both of you. Enjoy till you start your residency, and we wish you all the best for your residency and all your future endeavors. Um, we just wish you all the best. What specialty are you planning to go to after your residency?
After pediatrics, thank you first for all your kind words. I think I'm considered to be an endocrinologist
Wow, amazing.
after doing pediatrics. Yes. And also in my hospital, I also have my mentor who is a pediatric endocrinologist. He's super excited to work with me, to teach me, and to do research. So that's very exciting also.
That's amazing to hear. Thank you, Dr. Flavia, again.
Thank you too.
Again, congratulations. Enjoy. We wish you all the very best for your residency, because I'm sure I can see how positive and happy you are to start your journey. It's
Yes,
gonna be
thank you
amazing.
very much.
We wish to hear more from you, and everything you do. We wish you excel in that. Thank you for your
Thank you so
time
much.
and sharing your wonderful journey with us.
Thank you too. It's a pleasure to be in the platform, and for sure we will talk after this interview.
For sure.
Thanks. Bye-bye.
Bye.